Hello and welcome to another episode of Health Matters. I'm your health coach, Dr. Michael Chillemi. And in this episode, this is going to be number four in our series in Understanding Arthritis. So I think what we've talked about and what we've understood is a lot of information about our arthritis. I've taken you a lot of places. We're really going to jump into one of the biggest things is pain science. So one of the biggest misconceptions patients have is if I hurt more, my arthritis must be getting worse. That is simply not true. Because once patients understand pain, then they will stop fearing movement. That changes everything. Let me give you a little fact about cartilage. And we've talked about this, so if you hear it and you already heard it, which means good because you listened to one of my other episodes. So cartilage, which is the smooth cushion covering the ends of your bone, has no nerve endings. It cannot feel pain. That means that the pain from arthritis usually comes from the tissue around the cartilage, the lining of the joint or the bone underneath it, the ligaments, the muscles, and the irritated nerves around it. That's what that pain is. Uh, I've seen another one. Let me give you another fact. I've seen patients come into my office terrified because their MRI says they have severe degeneration. Now, I could have that another patient with an MRI that looks almost identical. And that patient is going hiking every weekend and not really concerned about their MRI that says they have severe degeneration. That's why in practice, we always tell patients we treat people, not pictures, right? So pictures show certain things, but you have to put it all together. It's not everything. That's an important fact. You have to understand it, but you also have to understand what the functionality is behind it, which is why every patient has their own treatment plan because there is no cookie cutter for anybody who's doing this the right way to make sure you're understanding the patients, right? You have to do individual plans for each patient. So why arthritis doesn't always hurt the way you think it does. So it's if you've ever looked at an x-ray or at somebody read you an x-ray and then again it says severe arthritis. So you're going to see severe arthritis more on an x-ray than you will on an MRI. And you will have it on an MRI, but you'll see it. Typically, MRI is for ligaments and tissues and discs. X-rays and CT scans are more for bone. Okay. So that's just an understanding. If you see something that says severe arthritis, you might immediately think, that's it. My body's falling apart. I'm done. I want you to know something. That may completely change the way you think about pain, right? It's not necessarily true, right? That's definitely not necessarily true. It's seeing those words arthritis does not necessarily mean that you have something so severe in there, but it might, right? So on the other side of the coin, it really might. So one of the biggest discoveries in modern medicine is that pain and damage are not always the same thing. And that's the biggest thing you have to take away. Pain and damage are not always the same thing. In fact, one of the most fascinating discoveries in modern medicine is that the amount of arthritis that's visible on X-ray does not always match the amount of pain a person's in. Yeah, again, I don't want to belay the point, but I have patients that come in and say, "Hey, my this other doctor told me I have severe arthritis, but doc, I don't feel a thing. I feel fantastic. I go play pickleball. I work out at the gym. I do this, I do that. It doesn't bother me. I don't know what he's talking about. I got all this arthritis. Then on the other spectrum, I have somebody that comes in who has mild arthritis. Say, Doc, I can't even get up out of a chair. It hurts when I get up, hurts when I walk, hurts when I sit. I can't walk more than 50 feet without a pain. I can't bend over to pick up my kids. I can't do this, I can't do that. And they got mild arthritis. So, how is that even possible? If arthritis causes pain, shouldn't more arthritis mean more pain? The answer is no. Simple answer is no. Pain is much more complicated than that. Here's something that surprises almost everyone. And again, your knees don't actually feel pain. Your back doesn't feel pain. Your shoulder doesn't feel pain. Your brain creates pain. Now, before you misunderstand what I'm saying, I'm not saying that the pain's imaginary. It's 100% real. But pain is an experience created by your nervous system after your brain receives information from thousands of nerve endings throughout your body. Think of your nervous system as an incredibly sophisticated alarm system. Nerves constantly collect that information. They detect pressure, stretching, temperature, inflammation, movement, potential injury. Those signals travel up the spinal cord to the brain. Your brain analyzes all that information in a fraction of a second, actually less than that time. I snap my fingers, and then decides how much protection your body needs. Sometimes that protection comes in the form of pain. Pain is your brain's way of saying, hey, pay attention. I'm over here. Hello, help. Something's going on. I need some protection. That's a very important distinction. Pain is always not a measure of damage. Often it's a measure of perceived threat. So in those joints that the joints don't feel pain. Remember, we talked about the cartilage not feeling pain. It's everything else around there, right? Those joints I mentioned are all those joints that have the cartilage. And that's the part that doesn't feel pain. So it is important to really, really understand two identical people can have the same x-rays and have totally different experience. I know this, I've said this. I understand I said it, but I think you really need to understand it because the pain is influenced by so many different factors. And if you get one thing clear from this is that your definition of arthritis by one doctor, and when somebody else looks at it, it is important to understand that is not a definition of your health for everything. It's part of it. It's not the whole picture, right? Because we also have the amount of inflammation inside the joint, how much muscles tightness, how much joint tightness, how much nerve sensitivity, how's your sleep quality, what kind of stress you under. Do you have anxiety, depression, previous injuries, car accidents, slip falls? What's your general health? Every one of those can influence how much pain you're in. That is why we treat the patient, not the x-ray or film. Because it is so, I've seen so many patients that had significant amount of arthritis that when I look at the film, I'm like, this person must be sedentary. They must not do anything. And then they'll be the most active person you've ever spoken to. That's why you can never judge a book by its cover. You have to read all the pages in that book to understand what's happening. So let's talk about something called peripheral sensitization. So when a joint becomes inflamed, inflammatory chemicals begin to surround the nerve endings within the joint. Those chemicals lower the activation threshold of the nerve. In simple terms, the nerves become easily excitable. Imagine a smoke detector that's working perfectly, normally, It sounds only when there's a significant amount of smoke. Now, imagine making that smoke detector so sensitive that goes off every time someone burns just a little bit of toast. That's the difference, right? That's what's happening to an irritated nerve. Activities that previously didn't do anything, it didn't cause you any discomfort, now begin to produce pain. Walking, standing, climbing stairs, even simple movements can become uncomfortable because the nerves have become hypersensitive. But you know what? There is another layer to this story that we got to talk about, and that's something called central sensitization. Say that fast 10 times. When pain continues for months or even years, changes begin occurring inside the spinal cord and brain. So the nervous system becomes better and better at producing pain. Again, this isn't because the patient is imagining symptoms, it's because the nervous system itself has adapted. Think of it like turning up the volume on your television. Your television's program hasn't changed. You simply amplified the signal. The same thing happens within the nervous system. Pain signals become amplified. The result is that relatively minor things may produce much greater discomfort than it did last time. That leads me right into the biggest problem that I see every day: fear of movement, the fear of pain cycle, right? Someone develops arthritis. They say, Doc, movement hurts. I don't want to move. They naturally begin moving less. At first, it seems logical, right? It seems logical, makes sense. Pain, don't move. Unfortunately, less pain equals weaker muscles, right? Weaker muscles then lead to stiffer joints, reduced circulation, poor balance. Less nutrients reach the cartilage. Remember, when you move your joint, that's how your cartilage gets its nutrients. So the joint becomes less capable of handling normal daily activities. The person becomes less active. This becomes the fear pain cycle. Pain leads to inactivity. Inactivity leads to weakness. Weakness increases stress on the joint. More stress produces more pain. The cycle continues. I remember a woman who came into my office convinced she needed a knee replacement because she could barely get out of the chair. She stopped walking because every step hurt. After we evaluated her, much of her pain wasn't coming from worsening arthritis. It was coming from the actual weak muscles around the joint stiffness. And the nervous system had become so overprotective. But once we addressed those issues and gradually got her moving again, she started walking further and further each week. Months later, she was back to traveling with her husband. The arthritis didn't magically disappear, but her life changed because she understood what was really driving her pain. I have another patient who came in and she was scheduled for knee replacement, and we did our protocol. We have some regenerative programs we do that helps patients. This patient walked up and down the stairs backwards because she wasn't capable of doing it any other way. Could you imagine walking up and down the stairs backwards? If she had to go up a curve, she had to go sideways or back into it because she couldn't lift her leg the other way. Debilitating, life-changing situations. That patient took about took about 8 to 12 months of different therapies and care. Did an amazing recovery walking up and down the stairs the correct way. Now, she's not running up and down the stairs, but she's walking up the right way. She's moving the right way. Her biggest thing that she wanted to do was be with her son as they graduated the Marines actually, and to be at on the campus where he was for his graduation, and there was a ton of walking, and she knew it, and she was able to do it, and she did it with a smile, and she took pictures and sent it over, and those are those special moments that you remember in your life where you changed somebody's life, not for just today, but for the rest of their life. And that's why we do what we do. So that's why you treat the patient. Okay, I digressed. Sorry. So one of the most powerful ways we interrupt the cycle is with appropriate movement. Now, I didn't say aggressive movement, it's appropriate movement. Healthy movement gives nutrients to cartilage, improves circulation, improves the strength, improves balance, reduce stiffness, improves confidence. One of the biggest goals of treatment isn't simply reducing pain, but it's restoring healthy movement. When movement improves, function improves. When function improves, quality of life improves. That's why so much of our treatment focuses on helping patients move better, not simply helping them hurt less. One of the greatest tragedies I see is when someone stops moving because they're afraid of the pain. They're afraid of their joints. In reality, the opposite happens, right? They're afraid of wearing their joints out and they're causing more pain. But the opposite really does happen, right? The less you move, the weaker, stiffer, and the harder everyday activities become. Appropriate movement is what you need. It's the solution. And that's why physical therapy is so critical for patients. It's not just simply do this and do that. I have some people who say the I have some people that say, "Oh, I could do this therapy in the gym. I do this and do that," and it's different. I can't stress to patients enough how different it is when you're in a controlled environment and you're doing certain tasks. And at first, those tasks might seem like, "Oh, come on, doc, give me a break. I could do this." Yes, you probably can, but maybe you're not doing it the right way. You got to tweak here, tweak this. And over time, you progress and progress and progress. And that's what leads to appropriate activities. It's the one of the harder things to have people understand is, Doc, can't I go to the gym and just lift weights? No, you cannot do that, right? You can't do the same thing that you were doing, otherwise you'd have done it already. There's a protocol and procedure, and that's why we do what we do, right? So chronic pain affects more than your joints, right? So if you think about this, if you have pain constantly every day of your life, it's going to affect your relationship, your sleep, your mood. You're going to be cranky. Your confidence, you might have decreased confidence. Your work, you're going to be very much less productive. Family life, right? You're going to be snapping at people. Many people living with chronic arthritis become avoiding things to do. They avoid the walk, they avoid vacations. They stop playing with their grandchildren. They give up golf, they give up gardening, tennis, whatever it is, because they're afraid of what the pain might do. That is truly an emotional burden, and it is truly real. As healthcare providers, we have to recognize that we're not simply treating joints, we're treating people, and helping someone regain the confidence in their body can be just as important as reducing the pain itself. Okay. A message I pretty much tell every patient. Um, I tell every patient something that I hope you'll remember after today's episode. Your x-ray is not your future. Your arthritis is real. Yes, we respect it, but arthritis doesn't automatically mean disability. It does not automatically mean surgery. It does not automatically mean stop doing the things you love. I've treated countless patients with significant arthritis who continue to live active, fulfilling lives. The key is understanding the condition, managing appropriately, staying as active as possible, and building treatment plans that are designed specifically for you. If there's one message I hope you take away from today's episode is that pain is real, but it doesn't always tell the whole story. Arthritis doesn't mean your body is broken. It doesn't automatically mean you need surgery, and certainly doesn't mean you have to stop living. The more you understand of how the pain works, the less power fear has over you, and you could break that fear cycle. And that's what we truly want to do is really, uh, that's when the healing really starts, is when you break the fear pain cycle. Pain is information. It's not always a prediction. And understanding that difference can completely change the way you approach arthritis. So, the information I've given you today is my opinion alone. Please don't take what I say as treatment guideline, diagnosis, anything of the sorts. If you have any arthritis problems or concerns, please see a licensed healthcare professional for your own diagnosis and evaluation. What I always say is your health matters and it's important. So that wraps up episode 4. I have one more to go, and we're going to talk about in that osteoarthritis, some diagnosis, some treatment goals, some of my approach that I do. And we'll get into that a little bit. And it's important if you know somebody who has arthritis, give them episode 1, give them episode 2, give them episode 3, give them episode 4, and 5's coming. 5 is on the way. So stay tuned till next time. I'm your health coach, Dr. Michael Chillemi. Till next time, I say be safe, be healthy, be well.